Hi everybody, it's the Dental Assistant Tutor, and today I'm going to go over how to fabricate a provisional coverage, meaning a temporary crown. Um, there are a number of ways that you can go about doing it, but let's just start off with PPE. When you're working with equipment like the handpiece, your hair needs to be up, especially when you're working during treatments. The other day I went to the hospital for my mother-in-law, and a nurse was playing with her hair within the room with gloves on. And then she went to typing. So, rule of thumb is your gloves should be on when you're taking care of things that will be in the patient's mouth, nothing else, not even a keyboard, really. If you do that, please wipe it off. All right, now the importance about PPE. One, you're going to be breathing in dust, okay? But because I'm recording, I'm not going to be wearing a mask. Second is your eyes need to be protected from anything that could be flying, which are the particles from the temporary. Um, and during treatment, the debris. Then your gloves need to be not too loose, but not too tight. Too tight will cause carpal tunnel. Too loose, you can get caught. If your gloves are like this and you're working with the high speed handpiece trying to trim the temporary, not going to work out for you. You're going to hear a big squeaking noise. So, what we're going to do is let's talk about how you can make a temporary. You can take a blue bite, which is a blue mousse material. It takes about 30 seconds. It's actually one of my favorite ways to do it. You would take your triple tray, open it up, and what you can do is um, load the blue mousse material on one side. You can do both, but I like to save on product because when it comes raise time, you don't want to be the one that has used a lot of things that you just didn't need to use. But take your extruder gun and just go back and forth with the blue mousse, okay? And then you're gonna have the patient bite down like this, okay? And wait 30 seconds, and then have them open and take it out. What I like to do with patients prior to taking any type of impression that they have to bite into is I like to have them practice biting into the triple tray because it seems like some patients are nervous or they get thrown off with having to bite in front of someone. So you have them practice. Say, biting your back teeth like you normally do. Okay. And that's how you'll do it when I have the material in place. So then you load it up, you do it for 30 seconds, you take it out, you rinse it off, and you look at it, make sure it's good. You do this before the doctor even preps. So maybe the doctor anesthetizes the patient. When you're ready to get the patient numb, it's always nice to go to the dentist and say, ready to anesthetize. Okay, they know what that means. So, and you do that, but then while they're getting numb, you can do the bite. Okay. Also, if you do not have an x ray, you definitely got to make sure you have an x ray for insurance purposes and other reasons. So make sure you have a current x ray, or the front office is going to let you know you should have took that x-ray, okay? And then you may not get paid for the procedure. It's also good to have an x-ray once the crown is seated so they know that the crown has been seated with that patient. Now, besides doing blue mousse, you can take a Alginate Impression, okay? Instead of doing 2 and 2 or 3 and 3, you just do 1 scoop of powder and 1 line on the beaker of the water, okay? Mix it up and then put it in a quadrant tray like so, okay? Make sure it's in there and then keep your finger in there the whole time so it doesn't come down. Take the impression, so that's 1 and 1, and you can use that. Another way, there's many ways you can make a temporary. So as long as you have the basic idea how to do it, then it's going to help you when you're faced with all these different options. If you're temping or starting a new job, you know, you can just say, well, we learn it this way, and then you're willing to learn it that way. No big deal. But it is nice to know how to make it temporary. Fabricate. Put that on your resume. Fabricate temporary crown. All right. So another way is you can actually start to take the final impression. Some use it that way, and then they just go ahead and have them bite down into it, and then use that for your temporary. There is also something you can do prior is take an impression, pour it up in plaster, and then make yourself a little splint, okay? And so now this is shaped like the tooth prior to the doctor trimming it down for a crown. So since you have the shape, you can fill the temporary material up, and there's different types of temporary material. Old school kind is snap powder liquid, and they call it the salt and pepper technique. Just like when you get acrylics done, they do a little powder, they do a little liquid, they mix it up. Same thing, you're going to put inside the tooth that you're working on. If you need to, turn this around, turn the impression around. You're in the room with the doctor by yourself, so you have all the control. You're in the operator's chair, so you're sitting behind the patient. The patient's not going to see if you're going behind their head going. They don't know what you're looking for, you know? And then you count the teeth, because sometimes there could be a tooth missing. So you have to make sure. Otherwise, if you put it in the wrong spot and you put it on, all the temporary material is going to go around a tooth that is not prepped. You're going to have a big old mess to clean up, because it does get hard. So either way, use this. You use the alginate tray, you use your blue mousse, whatever the case. You take your temporary material, you fill it up. You fill up that tooth. Now you don't have to go to the brim, to the margin, okay? Because there's a tooth still there, it's just a little nub. And so it's going to overflow a little bit. So you're going to put that down, and you're going to wait for it to set up a little bit. I normally wait about 20 seconds, 30 seconds, depending on the material that you're using and their time for it to cure. You're going to take it off and check it and see if it comes off the tooth, that it's shaping good, and then put it back on until it's hardened. You can take it off just a little bit before it's all the way cured, but if you take it off too soon, it's going to shrink, okay? So when you take that temporary off, say this was made out of snap powder liquid, and I took it off too soon, it's going to start to shrink, so it won't fit even around the nub of the tooth, okay, the prep tooth. If that happens, you can do one or two things. You can take your high-speed handpiece, okay, and you can adjust the inside of it, all right, and try it back on. If it doesn't work after so long, quit messing with it. You're on a time frame. You have to stay on schedule. So then just start from scratch one. Say, you know, I have to, it cracked or something. Just say something, and you have to start over, okay? Or not even use the word start over, because then they're thinking, oh God, I'm here even longer. Just say I have to make a few adjustments and do another 10, okay? Just something. All right, so after that, if for some reason, I have a lot I want to share with you, so I'm getting my thoughts together. If for some reason you are on the tooth and you cannot get it off, okay, you are going to grab the hemostats, okay? And the hemostats, you can gently grab onto the temporary, like so, when it's in the mouth. And you're not going to squeeze too hard, just enough to grab it. You're going to go gently back and forth to take it off, to break that seal. If it's the second appointment where you're seating the crown and you get the temporary cement, you do it that way. Or say the doctor had undercuts, okay? Some will tell you that they had an undercut, so be careful before you remove it. Take it out a little bit prior. because it will get stuck in there. But if it has an undercut and you wasn't aware of it and the doctor wasn't aware of it, it's going to get stuck. So you're going to need these. If you cannot get it off at all, don't waste time. Go get the doctor and have them use the hand pieces. The only way it's going to happen, and a spoon, and you're going to be there with your HVE, and you're going to suck up the pieces that are coming off. All right. Take your spoon, and to remove the temporary, another way is, and always use 2 fingers, okay? 2 hands. You're going to take it. I don't know if you can see it. You're going to take it and say this was on a prep tooth. Let me see if I can do it better. I'm trying to work with a non-patient. Okay. That's not going to work, but just imagine. So this is on the tooth. You're going to take the spoon and you're going to hold it here with the left hand, and with the right hand you're going to raise up. If you need to get on the other side, do the baton twirl. Keep holding it and turn it to where you can get it off the lingual. Take it out of the mouth and set it on the tray. If you're afraid you're going to lose it, take your pen or pencil and circle it on the tray and put the temporary in the middle of the circle. That way you can spot it visually a lot faster. Okay. Let's see here. So we did that. Oh, another thing. When you're seating a temporary, number 2 pencil comes in handy. Okay, say it's a difficult tooth. You can't really tell which one's the buccal and which one's the lingual surface. So what you're going to do is take your number 2 pencil and you're going to always mark the buccal side of that temporary. Okay, that way when you have to cement it, you'll know exactly what way it goes, and you're not trying to take it off and twist it and turn it and put it back on. So take a number 2 pencil, mark the buccal side, okay, and then put your cement in. All right. Now that's all for cementing and how to get started with the temporary. Now let's go into actually trimming the temporary, okay? Now, I need one that fits. You always want to have 2 pairs of cotton pliers, a clean pair and a dirty pair, for when you're working in the office. Okay, say you're trying this on. You're going to see that on the inside, there is a margin line, all right? With your number 2 pencil, what you're going to do is you're going to just kind of color it in a little bit on the inside. That lets you see the thickness better if you need to, if you're having a sight problem with that, because it can get blaring with the light and everything. Or you can just freehand it without the pencil for that part. But what you want to make sure is, you want to make sure it's not going to irritate the gum tissue after the appointment. And you have to make sure that it's not too thick. Otherwise, it's going to push that gum tissue out. Another thing is on the interproximal surfaces of your temporary, right here and here, you want to make sure it's not too thin or too thick. If it's too thick, it's not going to seat. If it's too thin, it's going to crack, or it's going to have a space between this tooth and the opposing tooth, or on the side of it, the interproximal tooth. So what you're going to do is you're going to make sure that it seats where you can floss and take that floss straight down and your temporary is on there and you're holding it there, okay, with one finger, and you're trying to floss at the same time, like that, okay? And then if it's easier, just let go with this finger that you help push it down with while holding the temporary on, because you don't want to drop that temporary. And then pull this out like this. Okay. Now, what I suggest is when you're placing your temporary, I don't have a prep tooth, but when you're placing your temporary on your tooth, what you need to do is, besides the number 2 pencil, is once you seat it, before you light cure that temporary cement, you're going to floss, okay? This is going to help you with the cleanup afterwards once it's hardened, okay? So you're going to floss straight down. Like I said, this is not a prep tooth, so it's going to fall. But you're going to floss straight down and pull out the side, and then you're going to pick it up and do it again on the Mezio. Now, you can take a micro brush, and you can always have the temporary on, and you're holding the temporary on, and anything that oozes out, you can clean that way. All right? Then you light cure, if it's that type of cement. Now, you can take Duralon and mix 50-50 with Vaseline and make a temporary cement that way. But write it in your clinical notes. Always write it in your clinical notes and write down that you fabricated the temporary. Now, if a patient has to come in, different patients constantly have to come in because of your temporaries, that's not making you look good. So make sure that you focus on how to make a good temporary to save the patient's time, drive time, gas, doctor's time. Normally, you can just go ahead and see that patient if you have to remake a temporary. That's why it's good to save your impression if you use blue mousse. That's why I like using blue mousse. It's cheaper. It takes less time to set up, and you can keep it in the lab box until the lab case comes in with the patient's name on it. So in case they break it eating something hard they weren't supposed to, or it comes off and they lose it, then you have something to fall back on. Otherwise, you're going to have to do a box one or get pre-formed ones like these and shape them. Okay, and pre-formed ones, you just fill it in with a material, your temporary material, and seat it down instead of even having to do an impression. There are ones out there that look just like this, but they're made out of composite. They are beautiful. And you just place, they're expensive too though. And you just place it on the tooth, you shape it with it, floss it, you light cure it, it's done. Or you have the ones that are already hardened and you have to fill them in with the temporary material and then floss it, light cure, and all that good stuff. Or you just got to do it from scratch, the old school way, salt and pepper it. All right, so with the hand piece, I'm going to show you guys how to adjust a temporary. So you've taken it out of the patient's mouth, okay? But before you did, what did you check for? Okay, you wanted to make sure how it looked in the mouth. You took the articulating paper, all right, and you have them tap, tap, tap gently, not too hard, gently, or they can fracture that temporary if it's not seated all the way, all right? You're going to take your Explorer, make sure that the margins, and it's flush to the margins. The bird was a little funky. And what you're going to do is you're going to take it and you're going to adjust like so, going around, holding on to it. If you feel like it's slipping, keep adjusting. Just go around on the outside. So you're adjusting on the outside, holding it like this. Do that, okay? If you don't know this, whenever you put your burr in place, you push that button, push it in, always pull it out to double check that it's locked in there before you use this. And make sure your gloves are not too loose right there so you can hold on to this. These have been known for flying, and then you gotta grab it because doctor can't do that. You have to do that. You're their assistant. Don't make them do that. And then you have to disinfect it because the patient knows this, unless maybe you can do it without them knowing that it blew when you're adjusting it. And so you just adjust it on the sides. And you want it about that thick. You don't want it any thicker than that. Now, for some reason, you put this on. You put this on the tooth, right? And say you got a big old space in approximately. Okay? It kind of looks like the right tooth for it. But say you have that space in between the tooth, you can do two things. You can take flowable composite and add it in approximately just a little bit onto the temporary, light cure it and adjust it and check it with the floss, or you can use packable composite, either way. I'll show you with the packable. I'm using some donated material and guns for the classroom. I appreciate those. If you have any, you can always send in your donations for the class of supplies that you don't use, because sometimes you get samples at an office. So remember the little people when you're out there chair signing. All right, so you're going to clean off your composite, okay, if it's hardened. You're going to take a little bit, like so, and put it on your temporary, okay? You can either do it with your finger or you can use an instrument. A composite instrument would be fine, whatever works, okay? There's no right or wrong when you're doing the work. I'm going to use the back of the spoon, the non-scooper side, and I'm going to shape it to the thickness I feel with my sight it needs. You got to keep looking at it. And the more I shape it while it's soft, the less I'll have to adjust it with the handpiece, which saves time. All right. And then I'm going to go over here. I'm going to light cure it, beep. And then I'm going to try it on the tooth. Okay. If you put it on with the composite being soft, you're going to just, what? Push the composite up off of it because it's still soft. Now, you can do the same thing with the inside, but with the temporary material. If it's too loose and it just wants to come off, okay, then you can fill it in with some temporary material. Or if you have like a hole spot, you keep adjusting, you're adjusting, and then, you know, you're checking the bite, constantly check the bite. It's going to be an in and out kind of thing. Dry it off, dry the tooth off. Take the articulate paper, have them tap up and down, you know, with the temporary in there, of course. And then if you see a blue mark on the top, that means it needs to be adjusted. So then you take your handpiece, you adjust the top of it, like so. Oh, and let's see if I have it nearby. Yeah, I do. Take that one out. Don't lose your burrs. And remember, if they're disposable, you're supposed to get rid of them. I've done some news on that, and some doctors are reusing disposable burrs. You're going to get in trouble with that. So say it marked high right here. I put the football diamond in. I like that one. Or I like the pointed diamond one for the interproximal, okay, because it's thinner. And you just a little bit, and then put it back in, check their bite, take it back out. They understand that you're trying to make it perfect for them, and let them know that. Communicate with your patient, do a little bit more. And if you need to, you can make anatomy into it. Use your fulcrum grip if you can. Rest your pinky on there so you don't slip. And what I like to do is I like to have my HVE on, you know, if I had it hooked up, and I would go ahead and do it over the HVE. That way you're not getting dusty. And I even move my operatory light right above me. So operatory light, it stretches so you can see better. Adjust it with the HVE, sucking it up, okay? Now, if my boss, not everybody does this, but whenever my bosses in the past had to do an adjustment on the temporary or a crown, something, um, take some old reline material, I would always take my suction and collect the dust so they don't get all dusty. So, and they'll know what you're doing when you do that. You just turn it on and let it just go that way. All right. I even sometimes, this is what makes you a good assistant. I even sometimes take my air and just blow their gloves off if I need to. Okay. You're their assistant. You are there to help them. Notice I have to push my glasses up. I'm not touching my face. I'm going like this. Remember that when you're working by yourself. When you're seating the temporary, here's a good keynote to do. When you have it on there and everything, what I like to do is take the air. A doctor showed me this once, and you blow the air around the temporary. Let me put it back on here. So you have it there, and what you're going to do is blow the air downwards, okay? That's doing two things. Moving that cement out of the sulcus of the tissue, all right? Plus, you can see down in there, the tissue starts to move away. The gingiva starts to move away from the tooth just a smidge, enough for you to see if there's any cement stuck down in there. You cannot leave cement down where the gingiva is because it will be like a sliver of popcorn skin and it's going to irritate the gum tissue, and then you guys will have to get a irrigating syringe and load it up and flush it out. All right, so let's review, okay? Because I know there's a lot to making a temporary, or if you like to use the word fabricate on your resume, it would make you look better, just being honest. So you can have preformed temporaries, okay, that are either soft, made out of composite, that you shape a little bit more, and the more you do before you light cure, the better off you're going to be. Or you can have ones that are hard, or even made out of metal, okay, the aluminum ones. And there's all different sizes for each tooth. So you're going to have a whole tub full of temporaries. Don't spill them. If that ever happens, just cold sterile them, dry them off, and then you're going to have to sit there and file them back in each spot. That's not fun. Uh, so anyway, you have that. So the preform ones, you got the metal ones. You can take 1 scoop of powder, 1 scoop of liquid, and mix it with the alginate, and take it in a quadrant tray of that side, and then remember to count the tooth. And then you're going to either do salt and pepper, or you're going to do a temporary material and fill it in. There's even a temporary material in an extruder gun, okay? There's that way. My favorite way is the blue mousse. 30 seconds, in and out, with a triple tray, have them bite down on it, practice prior, and then do the blue mousse. And then you have the final impression where they do the first part, the one color, they take the bite. And the reason why it's called a triple tray, just so you know, it takes the upper, the lower, and the bite all in one. So that's a triple tray. Okay, so that's that. And if you're going to do any of the impressions, that's just using either snap powder or the temporary material. Remember, you want to check with the floss to make sure that it kind of has a little popping sound. It's not too hard for them. And I always tell my patients to remove the floss by pulling it out the side, all right? Because if they pull it up, it's a temporary. There could be an overhang or something, and then it's going to pop off that temporary. So when your patient still needs to brush and floss that area, keep that tissue healthy. Pull it out the side, tell them, okay? A water pick's fine. When they have a temporary, remember, it's your job to go over the post-op instructions. So they're numb. Don't bite on your lip, cheek, or tongue. Your temporary is seated, but it could come off. If it does, call the office before coming in and we can re-cement it for you. What I used to do is I would write up little cheat sheet notes for patients, save them on the printer, print it out, little half a sheet, cut them out during downtime, giving them step-by-step instructions on how to see them themselves. And I would give them a little packet of temporary cement, one 2x2, and one micro brush. Okay, that way they don't get their hands dirty. That's it. And put in a little sterilization baggie, have them pre-made up. That way, especially if it's vacation time and they are getting a crown that last day, nobody wants to come in from vacation or the on-call doctor just to see one of your temporaries that came off. It's not always your fault if the temporary comes off. Sometimes they don't listen and they eat something. Oh, it just came off on a piece of bread. They could have ate something prior to that. Tell them no sticky, chewy candy and nothing hard. Sticky, chewy is going to pull it off. Something hard is going to break it. It's just a piece of plastic that's just temporary. A temporary crown can last for up to 1 year, but don't tell your patient that. Okay, that's just a rule of thumb. But the reason why you don't tell your patient that is you got to get that crown from the lab back within 2 weeks or less, unless you're doing steric, then you bypass a whole temporary if you're doing steric. But you got to submit it to insurance and all that good stuff. And you don't want the patient going that long with a temporary because, if the temporary wasn't made just up to par, teeth can shift and stuff like that. Speaking of that, if you do not fill in the gaps, between the teeth and approximately, when the permanent crown comes in from the lab, okay, they're going to have to do a lot of adjustments, okay, in approximately. If you have to adjust it in approximately, sometimes doctors have you adjust on the permanent crown, but they have to cement it in. But if they're adjusting it, why don't you have a little piece of articulating paper ready and you can put it on a pair of hemos, and then when they put the crown on the tooth, okay, in the mouth, that piece of articulating paper is going to be right there. You're going to place it there, okay, with the articulator holder. The doctor's going to put it down, and then what you do is you can tug on a little bit for your doctor, and then they'll lift up the crown, and it will show if it's kind of high or thick on the inside, the interproximal, and then you just adjust it, or the doctor adjusts it, okay? To make sure that the bite is good, you have to make sure that the bite is just right. So what I do is I take the temporary out before I cement it on, okay? This is how I check it when I'm all done and I feel confident about it. I say, okay, try your bite out. And they're numb, but give them time to really try to feel it out. Try your bite. Okay. Well, it feels good because that's just a normal bite, right? But then you put this in, try your bite out. Does it feel the same with it in and with it out? And I'll say yes or no. If it doesn't feel the same with it out, then you have to do some type of adjustment. So check with the paper. All right. Always fall back on that paper. And then you can also do another thing is you can take the articulating paper, and if I had some, I don't have any, but if I had some, I would go ahead and let me check here. Oh no, I have one sheet. Okay, so you can take the articulating paper, you can put it on an articulator holder, and you can have them bite down. I'll use this one because it has the upper and lower. So you have them bite down. Be nice if you can see it. So this is the patient's mouth, and they're biting down, and you can just kind of go like this, okay? And that's going to help see if it's high or not. Or just have them tap up and down. Be careful not to bite your cheek. And then they're tapping. When you take it off, you'll see if it's marking high or not. There's something called a shim stock, okay? And if you put the shim stock in, it looks like a little piece of aluminum foil or even articulating paper. You have them bite down, okay? And say it just slides right out, okay? Something's wrong. It's too high. Something's hitting high for it to just be able to slide out. They should be able to bite down and you tug and it doesn't come out, all right? And that's how you know if you're getting close with the shim stock. Let's see here. I think I'm gone over everything with you. Remember our number 2 pencil to mark it on the cheek side always. That way when you're cementing it in, you know. And oh, when you're seating a crown also, sometimes you can use a clue. A clue is a green spray. You shake it up. Make sure the inside of the temporary or permanent crown is dry. You do a couple squirts of it, and it's going to be all green. When you put it back on the tooth and you take it off, how the doctor and you can tell if it is um, marking or touching that part of the tooth is the green mark will be gone. So wherever the green mark is gone is where you'll need to adjust it. All right. If you have any questions, feel free to contact me. Um, enjoy making temporaries. It is like, take it like a art. It's just art. You're making a tooth. You're trying to make it very naturally, so they can live with it, especially if it's a front tooth. And don't be afraid if you need to. Say your temporary material isn't the right shade. You only have generic A2, C2, which are the common shades you can use on across the board. But say their teeth are a little bit darker. Take some composite material, okay, and take the darker shade, whatever shade you think it is, because after a while you'll know what shade they are, you know, what teeth, and put it on the facial part of the tooth. And if you gotta take two colors and shape it like that, and then light cure it and adjust it. All right. Same thing as if you're filling in the interproximals with the composite. These are little tips and tricks. I hope they help you with fabrication of a temporary. Um, don't forget to add it to your resume. All right. Till next, guys. Don't forget to like and subscribe. Oh, wait. There is one thing really important. Safety factor. Um, I read the other day that someone didn't know how to do this, and I felt bad for them. And these are really generic 2x2s. But you take a 2x2. Oh God, it's falling apart. So you take a 2x2, you open it up, okay, and say it's a little larger than that. Say you got to seat a crown, or you got to try a crown on, and you're nervous that it's gonna fall, okay, especially if it's in the anterior region. Make a drop cloth, okay. So if the crown does come and fall off into the mouth, you can grab the 2x2 and get it out of the mouth, okay? Whenever you're trying to crown on, it's nice to have the ones with the vents so nothing gets sucked down in there. But if your crown does get sucked up, it does go to the, if it's a permanent crown, it does go to the suction trap. So you know what you gotta do there. Anyway, what I like to do is when the doctor is going to try the crown on, and it's kind of questionable if he's going to drop it, I have my HVE right in my hand at all times. This is your go-to, okay? If a patient's about to get nauseous, this is your go-to. You're going to do a sweep of the back of the throat if it falls back that way. Don't push it down into the throat because it can go into the lungs, and then they have to get a chest x-ray. I've had to do CPR because someone dropped a stainless steel crown before. But what you're going to do is take this and just sweep the back of the throat like that. Sweep the back. Don't be scared. Sweep the back of the throat to suck up that temporary. Some patients will have the instinct to just sit up and pop it out, okay? I'm not telling you this to make you nervous when you're doing temporaries, but they are slippery, you know, slippery when wet, and you have to wear gloves, and that makes it slippery. That's why I like the texture gloves, and make sure that they're not too loose. That's very important, and protect yourself with your nostrils. Make sure you wear your mask and with your glasses. And remember, take that operatory light, bring it over to you. It moves above you, above the suction, and turn that suction on and just work right above it so you're not getting your patient all dusty either. Um, here's a fun fact, okay? No matter what your temporary turns out to look like, if you go to the lab and you polish it with some pumice, a little bit of water on the pumice, and a rag wheel, wet the rag wheel, you'll know what it is. It's a white rag on a wheel that turns real fast. It's called lathe. Okay, if you haven't learned that yet. and you just take it. And now they say you shouldn't wear gloves with that, so you can disinfect this, but rinse it before you take it back into the room because it's going to taste like disinfectant. But someone broke all their fingers on a lake before because their gloves were too loose and it caught it and twisted their fingers. Dennis once told me. So what you're going to do is, I do it without gloves, but I disinfect mine. Is put the pumice on here, and you're just going to polish that tooth, make it shiny. If it's shiny, it looks great, you know. Um, so just remember that. Always polish yours, even if someone else doesn't. There's many ways to learn how to make temporary, so whatever's best at your office. Like I said, there's no right or wrong as long as the patient can function with the tooth and it's comfortable and it's not so bad looking. Just keep that in mind. All right, guys. Take care. Bye. Good job.